How to use a tympanic thermometer. Correct. They are all advantages of the tympanic thermometer. Incorrect. They are all advantages of the tympanic thermometer. Let's first introduce you to the characters.
Hello, my name is Nurse Mimi. I'm your guide to the medical techniques. I may not always get it right, but I want you to learn from my mistakes.
I am your healthcare education guide. I have all the answers to your questions.
The tympanic thermometer measures temperature from the ear and with different mode settings will provide you with a measurement equivalent to an ancillary rectal or oral temperature. Inaccurate measurements can result from poor technique. Because of the cooling effect of the ear canal being exposed to the environment, the temperature will vary. This video will instruct you how to measure an accurate measurement every time and avoid some of the commonest problems. Pay attention, as there are some competency-based questions at the end. Steps to using the tympanic thermometer. So, how do you use a tympanic thermometer?
Hang on a moment. Have you cleaned the lens?
Ah.
A soiled lens will interfere with the reading. Check cleaning guidelines.
And check for scratches.
Oh, of course. I wouldn't expect to see clearly with a scratched lens.
A scratched lens will interfere with the reading. In the same way, it is difficult to see through scratched spectacles.
Oops!
Dropping the tympanic thermometer is a very common cause of damage to the instrument and of inaccurate results.
Hello, sir. My name is Nurse Mimi. I'm just going to measure your temperature. I'm going to place the instrument in your ear and you will feel a little pressure just for a few seconds. Something seems wrong. The reading is normal, but the patient feels very hot.
Well, if your patient doesn't look or feel well, then there is an error in the measurement.
How to use a tympanic thermometer. The correct technique involves using your non-dominant hand to gently pull the pinna of the ear both back and down. This helps position the probe at the correct angle to capture the radiation reflected from the tympanic membrane. The correct position of the tympanic membrane is the same as holding a phone. Because of the cooling effect of the ear canal exposed to the environment, the temperature will vary.
That's it.
Be aware of the measurement mode.
Good.
Why use a tympanic thermometer?
The location site is great. It's so easy to access the ears. The time is short. It only takes a few seconds. And environmental factors don't tend to affect the measurements, such as open mouth breathing or drinking hot or cold drinks.
The method is very important. What you don't see is what determines the temperature. The ear canal temperature is cooler than the membrane temperature. A poorly placed probe will produce different readings. Once the thermometer is in position, the reading should be taken immediately, and the thermometer should be removed immediately following the temperature reading. Will affect the reading. It is important to measure the same mode each time so that a change in temperature will be identified. Will affect the reading. Always check for these as a routine. Always question odd readings. Be prepared to test again with the same or different machine. The tympanic thermometer should be routinely calibrated to the manufacturer's guidelines. If in doubt, send for a repair. For verification, 2 measurements should be taken with 2 minutes in between measurements.